Did you know that every 3 minutes someone is diagnosed with this particular form of cancer? Worse yet, more people die from this particular disease than prostate, breast, and colorectal cancer combined. Do you know which form of cancer I'm talking about? No? Well, you're not alone, and that's just one of the reasons that we're talking about it this afternoon. The cancer we're talking about is lung cancer. More than 221,000 new cases will be detected this year, making up about 13% of all cancer diagnoses. Lung cancer is one of the most difficult to treat. It's often difficult to detect in the early stages, and it can take years to develop. What if I told you, though, that your body's immune system may be the key to helping fight cancer? Joining us from Chicago to tell us more about it are lung cancer expert Dr. David Spiegel, director of the Lung Cancer Research Program at Sarah Cannon Research Institute, and Stephen Young, who's the president and COO of the Addario Lung Cancer Medical Institute. Gentlemen, thank you so much for joining us.
Thank you.
So, Dr. Spiegel, let me ask you this real quick. Why is lung cancer, why has it been so difficult to detect and treat?
Well, as you mentioned, it's a common problem, and it's a problem that tends to lead to more deaths than any of the other cancers that we battle. One of the biggest problems is that we don't find out about it till it's already spread. We try to cure patients, of course. That's our #1 goal, by removing cancer if we can. But when it's already spread, you can't easily do that. So we focus on other therapies to try to control cancer. But that's essentially what makes things so difficult, is that we don't find out about it till it's already spread.
So what would you consider is the current landscape for lung cancer patients?
The current landscape, I think, is very positive. We've always had surgery, as I mentioned, radiation therapy, something I think people are familiar with, the term called chemotherapy, using medicines to go through the body to control cancer. That's been the standard way we've addressed really all cancer for over 3 decades now.
Right.
What's been exciting, as you alluded to in the beginning, is this idea of using a person's own immune system, their own self-defense system that fights daily infections, fights off flu, bacterial infections, to use that to identify cancer and kill cancer.
So researchers are looking at a way to help the body do that. How are they doing that?
So there's been a development of a number of drugs over the last 3 to 4 years that were designed to boost a person's immune system to fight cancer. A couple of these are actually already approved to fight a type of cancer called melanoma, skin cancer. But what's been real exciting and certainly gratifying for me personally is the focus in lung cancer. This past March, the FDA approved a medication by the name of nivolumab, a patient you get in the outpatient setting in your own community, a drug that's not really associated with much in the way of hardship for patients.
Right.
And we've been able to show at this meeting in Chicago, as you mentioned, is that this drug appears to be better than chemotherapy at allowing more patients to live longer.
And you've been following this closely.
Yeah, we've been very fortunate at our center, Sarah Cannon in Nashville, to be involved in what are called clinical trials, ways of trying to prove that newer approaches like this are better than older approaches like chemotherapy. Yeah. So yes, many trials, and our meeting here is really designed to share the news, to share the results of those studies.
Wow. Okay, doctor, thank you. Stephen, please forgive me. I didn't mean to ignore you all this time. What exactly does all this mean for the lung cancer community?
Quite honestly, survival. We now have drugs and treatments that will allow patients to live and see the key milestones in their lives that they previously would have some doubts about whether they were going to achieve. Right. You asked about about immunotherapies. Nothing could be more personal than turning your own immune system against the cancer cells that are in your body. So I think we see an incredible sense of optimism in cancer patients, and in lung cancer in particular, over the past 2 years. And the results that we're hearing in Chicago of potential doubling of survival of certain patient groups, it's just off the charts exciting.
Stephen Young, Dr. Spiegel, thank you so much for your time with us this afternoon. Now, if you'd like to learn more about immuno-oncology and its uses in fighting lung cancer, just go to our website, WBOC.com, and click on our picture at the top of the page.
Well, maybe your loved one has cancer or another disease, or maybe they're just not able to take care of themselves like they used to, and you stepped in to help. When you're a caregiver, you want to make sure your loved one gets all the attention they need. But as you know, life happens, and there will be instances when you just can't provide that proper care. Delmarva Life's Sean Stryker stopped by Heritage at Dover to find out how respite care can help senior citizens get everything they need while allowing you, the caregiver, time for yourself.
If you're a caregiver to your parents or grandparents, you know it can be quite the commitment. Most of the time, it's one you're happy to make, but that doesn't mean there aren't instances when you need some time for yourself. When that's the case, respite care can help.
Another name for respite care would be the gift of time, in which we give caregivers a respite or a break from their daily caregiving activities so that we care for their loved ones while they take care of themselves.
Beth Gerald is the executive director of Heritage at Dover. She says caregivers choose to use respite care for a variety of reasons.
Many times they go on vacation. Many times they just need a break. Several of our previous clients have had medical procedures that needed to be completed, and they needed some recovery time after their procedure, so we care for their loved one while they recover.
Beth says taking some time for yourself could improve the quality of care you provide to your loved one.
You can only be as good to those you love as you are to yourself. So if you are not feeling well, if you have a lot of pressure on you, you can't take good care of the person that you love. So it's better to take a break, take care of yourself, and then let us take care of your loved one so that at the end of the stay, the period of time that we're caring for them, everybody feels better and everybody's rested and ready to start again.
Welcome to Heritage. Nice to meet you. My name is Kyla.
During their stay, a resident will experience a high level of care, which the staff starts preparing for well before their arrival.
We do a thorough assessment and get to know the potential client before they ever come. We do a complete assessment of their loved one, set up a service plan, in which case we line up any services that we do for them. So it could be bathing or dressing, or we fix all their meals, their housekeeping, laundry, all those things, so that the caretaker can rest assured that their loved one's taken care of, and then they can do whatever they have to do to take care of themselves.
A typical day at Heritage can be made up of all types of activities, including dancing, exercise classes, excursions to the beach, or just hanging out, relaxing with new friends. Beth says it's more like a vacation that allows your loved one to regain independence.
It's difficult to feel like a burden to your caregivers, and even though I don't think your caregivers feel that you're a burden, you may feel like you're a burden. And I also think that they come to realize that they can be more independent with just a small amount of support from the staff that's sort of underlying.
I'm going to take your blood pressure if that's okay.
That support includes an around-the-clock nursing staff to look out for their well-being.
24 hours a day, nursing staff and personal care assistants. So the residents are safe and secure in their environment, getting all the medical attention that they require and are used to. Medications are administered to them. We're in contact with any medical doctors or medical personnel that they're familiar with. Our staff is trained to take care of seniors.
Good afternoon, everybody. Good afternoon, ladies. How are you today?
Fine.
With the combination of exceptional care and recreational activities, Beth says her clients often wonder why they waited so long to use respite care.
I think that most of the time they're surprised at how well their loved one adjusted when they were here, how much fun they had. I think that they think they should have done it a lot sooner rather than waited so long and worried about it for so long. It's just so easy, and it's a very comfortable process. Everybody has a great peace of mind, you know, at both sides. So they're very satisfied, and we often have repeat people come back many, many times to do respites.
And Beth says another thing respite care can do is give your loved one a taste of what it's like living in an assisted living community without the long-term commitment.
It's good for your mental health. It's good for your physical
Everyone
health.
needs a break.
It's a great thing. Well, while we're talking about physical health, let's talk about the health of your ears. Maybe you're one of the 48 million people with hearing loss, and you rely on a hearing aid to take in the sounds of the world. For many young people, wearing a hearing aid can be tough. Up next, how one social media movement aims to remove the stigma often associated with the device.
And later, you're going to want to listen up when we head to the Delmarva Life Kitchen. Today, we're making an appetizer to wow the crowds, tuna nachos.
But first, we've been talking about your health. Could hypnosis be the key to keeping it on track? Dr. Oz says maybe.
Hi, I'm Dr. Oz. Hypnosis is more than just mesmerizing. It may also help you turn your health around. Hypnosis has been studied to help people overcome stress, stop smoking, and reduce chronic pain. Adding medical hypnosis to your weight loss routine could even help you slim down. A licensed hypnotherapist can get you started, and then eventually you can learn self-hypnosis.